Hello there and welcome to this tutorial on leukemias. This is part 1 where I will be giving an overview of the condition.
Disclaimer, this video is aimed at medical students for learning and revision purposes only. For medical advice, seek a qualified clinician. Every effort has been made for the information to be as accurate as possible and in line with the UKMLA specification. However, if you find any errors, please notify in the comments. Note, this video is not sponsored or accredited by the UKMLA, MSc or GMC. Hope you find the tutorials useful. Best wishes.
Let's define leukemia. Leuk means white cells and emia means in the blood. In leukemia, there is an uncontrolled production of white cells by the bone marrow, causing a raised number either in the bone marrow or peripheral blood, depending on where you take the sample from. The condition can be classified as acute, characterized by immature blast cells, and chronic, characterized by mature white cells. Acute leukemias can be further divided into acute lymphoblastic and acute myeloid. The same applies for chronic leukemia, which can be chronic lymphocytic, as is the name given to mature lymphocytes, or chronic myeloid. Now, if we look at the lineage of white cells only, the myeloid stem cells give rise to granulocytes, which are basophils, neutrophils, and eosinophils, and monocytes. The lymphoid stem cells gives rise to natural killer cells and lymphocytes. Hence, myeloid leukemias affect predominantly the granulocytes, while lymphoid leukemias affect lymphocytes, often the B lymphocyte. So what can increase one's risk of leukemia? The underlying pathology of cancer is uncontrolled rapid production of cells due to mutations caused by either direct insult to the DNA or from poor DNA repair mechanisms. The first is bone marrow suppression, which can be caused by ionizing radiation such as radiotherapy or chemotherapy drugs such as alkylating agents. Infective causes is predominantly from human T lymphotropic virus, HTLV for short, and finally genetic risk factors include Down syndrome, which is associated with acute lymphoblastic leukemia, immunodeficiency syndrome such as hypogammaglobulinemia. Leukemia roughly affects 1 in 100 of the general population, with males being more commonly affected. The cause of leukemia is often unknown in most patients. The table below summarizes the age group which has the highest incidence of each leukemia subtype. Generally speaking, acute leukemias affect younger people, while chronic leukemias affect older people. Acute leukemias occur due to mutations in hematopoietic stem cells, causing uncontrolled production of immature blood cells. These accumulate and occupy more space in the bone marrow, meaning less space is available for normal blood cells. Now, the blood test mainly measures mature cells in blood, which will be in low numbers as fewer normal cells are made. A blood film or smear can show blast cells, which are larger immature cells. A bone marrow biopsy is needed to confirm the diagnosis, which will show a hypercellular marrow, i.e. the marrow is overpopulated with cells as seen in this image. Chronic myeloid leukemia, or CML, is a myeloproliferative disorder causing proliferation of all hematopoietic stem cells, specifically granulocytes, which are the cells that end in phils. Unlike acute leukemia, cells of CML do mature. Characteristic feature of this condition is the positive Philadelphia chromosome, which occurs due to translocation of genes in chromosome 9 and 22. But do note that not all patients may be positive. CML consists of 3 phases: the chronic phase, which is responsive to treatment, the accelerated phase, which is a period where disease control is difficult, and the blast crisis, where CML can transform to acute leukemias, often AML. Blood tests typically show leukocytosis, thrombocytosis, and specifically neutrophilia. A buzz tip: if neutrophilia is of unknown origin, i.e. not due to infection or inflammation, consider myeloid leukemia. Chronic lymphocytic leukemia is a leukemia of the elderly with an average age of onset being 72 years old. It is due to uncontrolled proliferation of mature B cells. Mutations in these cells make them immunoincompetent, i.e. cannot properly make functional antibodies to pathogens. Hence, hypogammaglobulinemia is a characteristic feature resulting in recurrent infections. The disease has an insidious onset and patients often are diagnosed incidentally following a blood test. Investigation-wise, a blood film can show small lymphocytes, which suggest mature cells, and smear cells, which occur when preparing the blood film. As these cells are old and fragile, they break easily, causing this characteristic appearance. Let's see a few signs that may suggest an underlying leukemia. Gingival enlargement is a typical feature of acute myeloid leukemia. As the bone marrow cannot make functional blood cells, extramedullary hematopoiesis occurs, i.e. the gum starts making blood cells. Lymphadenopathy is a common feature of lymphocytic leukemia, as lymphocytes reside in lymph nodes. Increased numbers causes them to swell. Splenomegaly is a feature associated with myeloid leukemias. As the spleen breaks down blood cells, they enlarge as there are too many in the bloodstream. Finally, petechiae, which are small skin clots, and purpura, which are medium skin clots, are suggestive of thrombocytopenia and is a feature of many leukemias. Thank you for watching this video. I hope you found this useful. If you did, please make sure to like and subscribe.